It is said if you don't have eyebrows, you really don't have a face. And if you are the one who lost your eyebrow hair or have a faded brow tattoo or desire a fuller eyebrows, an eyebrow transplant can be a suitable option to restore your gateway of face. In medical conditions like trichotillomania or alopecia areata, if you have experienced skin damage from injuries like burns or scars, eyebrow restoration can rescue to restore your look. Also, can be done to improve or recreate eyebrows. It is an aesthetically essential to follow the direction of eyebrow hairs while creating a new line. You need specialists to discuss your goal, assess your eyebrow area, and determine the best approach. Hair follicles are typically harvested from the back or the sides of the scalp where the hair is similar in texture to eyebrow hair. Around 150 micrografts are usually required for an eyebrow of one side. The donor site for eyebrow transplant should be of finer hair, preferably from the nape of the neck or the temporal region. Recipient holes are made with the help of 20 or 21 gauge needle or 0.7 mm diamond slit. After the procedure, you might experience some swelling, redness or scabbing. It is important to follow post-op care instruction to ensure the best results. The rate of the growth of the hair scalp is much faster than those of eyebrows and elsewhere. So transplanted hair will need trimming from time to time. It is very important to form a team because one individual cannot perform the entire procedure single-handedly. Fine-tuning and accuracy in all steps of the surgeries are essential to get a good results. No compromise should be made with proper lighting in the operating room with the high quality of instruments. If you are considering the procedure, it is a good idea to thoroughly research the clinic and consult with a specialist to see if it is the right option for you or not.